afternoon, one and all. Myself, Dr. Sandeep Dahilekar, Professor in Rog Nidan Department. Today we have our 17th pedagogy session, and this session, the keynote person is Dr. Satej sir, and Dr. Satej sir is Associate Professor in Dravya and he is a keynote person of today's Doctrine in Signature. So I request Satej sir to start their session.
Thank you very much, Dr. Sandeep sir, for providing me an opportunity to speak on the topic Doctrine of Signature on the 17th pedagogy session. So today we will see about what do we mean by the Doctrine of Signature. So myself, Dr. Satej Panne, I am working as an associate professor in the Department of Dravya Guna in Parul Institute of Ayurveda, Parul University. So coming towards the introduction, so Indian physicians and philosophers believe that man is an epitome of the object of this universe. So man is considered as an epitome, and there are so many principles in Ayurveda also and in homeopathic classics also. So like cures like is the one similar principle is there in Ayurveda also. And today the idea of like cures like lies at the heart of the Indian tribes and folklore system of Indian medicine. This belief become known as a doctrine of signature, and this principle is also called as a Lokasamya Purushvada. So, in the context of Dravya Guna, how this principle basically works for the physicians, that we'll see in this upcoming presentation. So coming towards the similarity between the body and the universe can be understood in two ways. So this similarity is divided into two types. First one is the anatomical, or anatomical similarity is also called as a structural similarity, and second similarity is called as a functional similarity. So there is a one principle in Ayurveda, that is yatha loke tata dehe. Yatha loke means whatever there is in universe, that similar anatomical structure is present. Otherwise, similar structure is present in our human body. Clear? So in this way, this similarity is divided into two types. First one is a anatomical, and second one is functional. So we'll see the one example. So walnut. So everyone knows it. So its a botanical name is Jubilans regia, and in commonly it is called as acron. So see, this walnut basically is exactly looking like a structural similarity is exactly looking like that of the human brain. So there are various references of walnut in Nigantus also. So due to this structural similarity, walnut is exactly looking like that of brain. So walnut is mainly useful in a brain disorders, and it is a proven now. Right. So coming towards the chemical composition, so walnut basically is rich in amino acids, crude protein, dietary fibers, starch, etc. And it is a rich source of omega-3 acids. So there are so many research activities also carried out on walnut, that having the fistful of walnuts helps in propping up our brain cells. So coming towards the second example, so we'll see the various examples as per the Dravya Guna classics, because Dravya Guna is a very much important subject, and as per the Raj Nigontu, it is also included in Ashtanga Ayurveda also. So second example is a carrot. So carrot is nothing but the garjar. In Sanskrit it is called as a garjar, or commonly it is called as a gajar. So carrot, see the structural similarity of the carrot is exactly looking like that of eye. So whenever we take the cut section of carrot, so it is exactly looking like that of eye. So as per this structural similarity, that is yatha loke tata dehe. Lok is the universe and human body, right? So this is the similarity is present in the universe as well as in the human body. So there are so many references of carrot, that is it is useful in eye disorders, right? So when we cut the transverse section of the carrot, so it is exactly looking like that of the retina, right? So carrot, everyone knows it. So it is a rich source of vitamin A or carotene, and carotene is a precursor of vitamin A. It is also the source of flavonoids, riboflavins, vitamin C, vitamin A, right? So, due to the rich source of vitamin A, carrot plays a most important role in eye disorders. So, it is highly beneficial for eyes or dry syndrome, cataract, or muscular degeneration, dry eye syndrome, etc. So, we have to prescribe, or during the patyapatya or wholesome or unwholesome diet concept, we have to prescribe particularly carrot to the people who are suffering from the particularly eye disorders. Like likewise, I have given examples. So, for example, cataract. If someone is suffering from the cataract, so in patya we have to give the carrot because its structural similarity is exactly looking like that of eye, right? So this is called as a doctrine of signature, as based on a Dravaguna classic. So coming towards third example, everyone knows the tomato, right? Tomato. So its a botanical name is a Solanum lycopersicum. It belongs to the family Solanaceae. When we'll take the cut section of the tomato, it is exactly looking like of the four chambers of the heart, that is left atrium ventricle and right atrium and ventricle. So it is structurally this tomato is particularly looking like that of the heart. So that's why we have to use the tomato in various heart disorders. So many references of tomato are there in modern classics also, that it lowers the LDL because it is the rich source of a lycopene, and lycopene particularly acts on a LDL level, or it reduces the LDL, or it is called as a bad cholesterol, and it helps heart from the prevention of the blood clotting, and which lowers the stroke risk, right? So we have to use the tomato for the heart function. So this is the third example of a doctrine of principle or doctrine of signature. Coming towards the fourth example, so it is called as a beetroot. So everyone knows it, and it is widely available in a market also. So this is the structural similarity, that beetroot juice or beet, when we will take the juice in a grinder, so it is exactly looking like that of the blood. So this is the best example of a doctrine of signature based on a Dravaguna principle. So beetroot is a red in color, and our blood is also red in color. And coming towards the main chemical compositions, so there is betanin and flavonoids. So in various nigantus also there is a references of beetroot juice. So it aids in a contributing to the color of the blood due to the presence of betaine. So main chemical composition of the beet is a betaine, and the ingestion of this particular mineral is essential for hemoglobin production. So betaine is mainly responsible to produce the hemoglobin. So one has to take the beetroot. So in anemic patients, usually we prescribe the beetroot. You have to take the beetroot juice. So main reason is the chemical composition is betaine. So this is now in nowadays it is proven that it is a rich source of betaine, and betaine is responsible for hemoglobin production. But in Ayurveda classics already we are having the references of the beetroot juice. That is called as a doctrine of signature because it is already explained, and beetroot juice is exactly looking like that of a blood. That Siddhant is particularly called as Yatha Loke Tata Dehe. Whatever there is in universe, that structural or functional similarity is present in our human body, right? So similarly, so many examples are there. For example, I will go in detail with a few examples. So Manjista, everyone knows it. So Manjista is in clinical practice, it is used as a Raktapachak, or in a blood disorders they are using Manjista. So its a botanical name is a Rubia cordifolia, and everyone, for example, in Raktagata Vikara, for example, Nilini, Kamala, Venga, Pilva, Tilakalaka, or so many disorders which are explained by Acharya Charak in Sutrasthana. So we are using Manjistadi Quat or Mahamanjistadi Quatam. So the reason behind it is the same, that is called as a doctrine of signature. So Manjista Quat is particularly looks like a blood, right? So beet is also one example. Second example is a Manjista, right? So Manjista Quat is resembles like that of the blood, and hence it is useful in all the types of the blood disorders, right? So that's why we are using Manjistati Quata in blood disorders like Nilika, Kamala, Vyanga, Pilva, Tilakalaka, or whatever the Raktagata Vikaras are explained in Ayurveda classes. So we have to use Manjista The basic motto or basic reason is the doctrine of signature. So it is already explained nowadays in 19th century or the 20th century, as per based on the modern parameters, they are telling that, for example, betaine is the main chemical composition of the beet and it is responsible for the hemoglobin production. So already our Ayurveda acharyas or Nigantukaras, they have observed this principle, right? But that principle is yatha loke tata dehe. So next best example is a kapi kachu. Everyone knows it, and in Gujarat also one famous avleha that is called as a kauncha paka or kauncha avleha. Because see the structure of the kapi kachu. So these are the seeds of the kapi kachu, and kapi kachu seeds are exactly looking like that of testis, right? So kapi kachu is called as a mucuna pruriata. It belongs to the family Fabaceae. So Kaunchapak is the famous formulations and everyone is using in oligospermia as well as in erectile dysfunction. So Kaunchapak is atyanta tikshna and ushna, and it stimulates the nervous system, and that's why we have to use the Kaunchapaka along with the milk, right? The seeds of the Kapikachu are exactly looking like that of the testis, and hence it is useful in the Vajikaran purpose or aphrodisiac purpose. So simple, we have to prepare the kamcha pak or various formulations of kapikachu, and we have to use in erectile dysfunction, otherwise in a oligospermia. So kapikachu plays most important role because it is exactly looking like that of the testis, right? So this is called as a doctrine of signature. So various examples are there.